Hi and welcome to my channel. So as you know, well, if you don't know, I'm telling you now, the NHS, which is the National Health Service in the UK, has got a massive plan coming up that has been released by the government, which is called the NHS Workforce Plan. So basically, this is the plan going forward for the NHS. So one of the biggest changes that they have announced that is going to be coming into force is that NHS workers will be banned from working agencies, which means that if you're working for the NHS, you will not be allowed to work agency as well. So the only option will be that if you want to work agency, for example, as a nurse, you will have to resign from your NHS job and then do agency. The reality about the fact is that that is not going to work for many people because, for example, if you are an overseas worker, you're not able to do agency full time, which means that the only option you have will be to work full time for the NHS. And if you're doing any extra shifts, those will have to be done with the NHS. So I'm going to be telling you in today's video what impact is this going to have when it comes to overseas recruitment. How is this going to affect overseas recruitment? Because as you know, every action that is taken has consequences. Whether those consequences are positive or negative, but reality is that there are consequences. If you're in the UK, for example, and you've never been considering career progression, this is the perfect time because this NHS workforce plan is absolutely amazing for somebody who is keen on career progression because having more apprenticeship opportunities so that you can progress more. Staff are going to progress into managerial positions so that those people that are currently the top managers with no healthcare background or experience are going to be sacked. That's what the plan says. So that those of us, people like myself, for example, who are nurses, who understand what healthcare is, who know what it means to be a patient, and most importantly, what it means to work for the health service, go to the ward, care for patients. We are the people that are going to be managers in the NHS, compared to the current state where you have random people who are from finance or, whatever background occupying those top positions. So if you're new to my channel, obviously, you're welcome. If you are a returning subscriber, I do appreciate your time. And look, if you haven't subscribed to this channel, you want to hit that subscribe button right now so that you're the first to be notified every single day when I drop a new video on here at 10 a.m. UK time. I'm dedicated to bringing you this information, making sure that you're the first to be notified with any single news that is going on in the UK. So I share information on here about career progression opportunities in the UK, such as what I'm going to be sharing in this video: free UK visa sponsorship, jobs and opportunities, whether you're switching your visa from within the UK or you're out of this beautiful country looking forward to coming to the UK, so that you're not spending thousands of pounds to get to this country. You know what I mean? And you're not spending millions of money getting into debt to get to the UK. I'll teach you how to get the jobs yourself. What does the job need? How should you position your CV? What do you need for the interview? And every single thing that you need. Also, work from home jobs that you can do from the comfort of your home to earn extra income, especially with the changes that the NHS is announcing. Look, you will need these strategies that I'm talking about. If you've been doing agency nursing and you're losing all of that, you need an extra way to earn money, because these are things that I do and they earn me a lot of money, more than what I earn from nursing. So if you check the comment section below, you're going to see a link to join that free newsletter. Once you join, I send that information directly to your inbox. And look, it's not going to take you up to 20 seconds to join. You drop your name and email and you are part of the newsletter. Also, like I've said, career progression, but most importantly, starting your own side business. The reality of the fact is that you need independence. All of this ultimately has to lead to independence. When you're independent financially, that's where you've made it. It doesn't matter whether you're in the UK or out of the UK, but if you're not financially independent, look, there's going to be so many inconveniences. It doesn't matter how much your job is paying, it doesn't matter how high you earn, there are many inconveniences with being employed. So I'm very passionate about starting your own side business so you can retire early, enjoy life, and live a beautiful life. So again, that's what I'm about. I also have a private career coaching program where I support with all of this. So like we were saying, the NHS workforce plan, what is the impact of this going to be when it comes to overseas recruitment? The reality is that it is going to massively increase the need for overseas recruitment. And that's why you see that year after year, if you look at the data from say 2020 till now, overseas recruitment has almost tripled every year following that. Look, this is not a coincidence. It's because overseas recruitment is the cheapest way to kind of bring in staff to the UK. If you look at example nurses, but if you're watching this, you're wondering who I am. So my name is Melvis. I currently work for the NHS myself as an advanced nurse practitioner. So I started my healthcare journey here in the UK working as a carer in a nursing home. I then went on, you know what I mean, to study nursing as an international student. I graduated obviously with a first class degree in adult nursing. I've gone on to do a mentorship course at master's level, and I'm currently concluding my third year Master of Science in Advanced Clinical Practice. Look, career progression is something that I enjoy. Over 10 years, since I started my nursing journey, I have done incredibly well considering, you know what I mean, the challenges that this country has. And so I have a private career coaching program where I support nurses, carers, students, student nurses, prospective student nurses, people that want to get into healthcare, anyone that is looking for free UK visa sponsorship opportunities. If you check out my private coaching program, check the link in the description box below or the about section of this channel, and do make sure that you're 100% joined, because when you do join, you and I are going to have that one-to-one session to go through what do you want, what do you expect, what's the best opportunity for you to move to, whether you're switching your visa, looking for career progression, you know what I mean, in the UK, looking for the next best thing to do. We'll go through that, your CV, make sure it's spot on, interview preparation, make sure that you're ready, you optimize yourself, you're the best candidate, and you're your best self. If you're a nurse and you're thinking, I want to become a nurse anesthetist, nurse endoscopist, advanced nurse practitioner, I want to get into management, you know what I mean? What else can I do? I want to become a specialist nurse, research nurse. I can guide you with that journey. My program has all of the resources that you need in order to excel. So you want to check that out 100%. If you're watching this video, you're watching until now, that program is perfect for you. And do make sure that you 100% join. Also, if you've got any questions regarding that, do check the comment section. Obviously, you're going to see my newsletter. It's got my contacts on there, and you can contact me with your questions or drop them obviously in the comment section below. So like I was saying, all of this is going to significantly increase overseas recruitment, because one thing that I'm going to tell you now, if you don't know, is that it can cost a maximum of £10,000 to recruit a nurse, for example, from overseas. And the truth about the matter is that many NHS hospitals are now not using agencies. They have realized that if they have their own internal recruitment systems, it's going to significantly reduce how much they're spending on agency cost, which means that it ends up costing you maybe about 5,000 or less to recruit one nurse from overseas. But do you know how much it actually costs to train one nurse in the UK to become a qualified nurse through the apprenticeship pathway? It costs about £140,000, which means that if you are, say, an NHS hospital and you're going through the apprenticeship system, and I've got many people in my private coaching program now that are currently going through apprenticeships. Many of them came to the UK as carers, for example, as midwives. They were in other sectors, but obviously they've watched my videos. They're like, hey, Melvis, I'm keen on nursing, girl. And now they're going through these apprenticeships to become qualified nurses. Because for the apprenticeships, they are being paid to study nursing. It costs their employers about £140,000 for them to become a nurse. But if you recruit a nurse from overseas, it's only going to cost you about £5,000. So if you can see what I'm saying, so one apprentice will cost £140,000 to the employer, but one overseas nurse only costs £5,000. And you can see that if you take one overseas nurse, how many apprentices are you going to have? If you take it's a no-brainer, and that's why overseas recruitment is a massive thing right now in the UK. And so if you're watching this and you're out of the UK, you're considering moving to this beautiful country, look, don't be worried about IELTS or ET if you're a qualified nurse or midwife. It is well worth it for you to move. But if you can move in as a carer and then upgrade when you get to the UK, it is an amazing pathway, because the NMC, which is the Nursing and Midwifery Council here in the UK, has introduced many new pathways that you can now get your NMC PIN number. You can become a qualified nurse or midwife without writing IELTS or OET. Again, I've done videos about this particular pathway on this channel. So look, you want to make the most of those opportunities. I remember initially when the carer pathway was introduced, and I had people that were saying to me, Melvis, can I come to the UK as a carer and then transition into nursing? This is when it just started. I was thinking, look, this is crazy, because the UK is going to be getting qualified nurses and midwives from overseas often these are very senior colleagues to come and work as carers. But the reality is, considering the other changes that the NMC has now implemented, look, it is a no-brainer. It is well worth it, even if you come as a carer and then upgrade from within the UK. It is amazing because you've got better opportunities. I'm saying this because I know people that have written out to OET several times. They have not been able to have the required grade. But if you take the leap and move to the UK as a carer, then you can pursue the other pathways for you to transition into this. If you're somebody who doesn't have any nursing background, no healthcare background, I can also guide you to get into healthcare and become a qualified nurse, through any of those pathways that are currently available. Because look, this country, the main thing that brings many of us to the UK, opportunities, career progression. So if you're already here or you're wanting to move here, look, that has to be the top of your mind, because that career progression is going to help you not only to earn more money, but it's going to help you work less, improve your finances, improve your well-being. And that is going to be good for your family, and it's going to make coming to the UK worthwhile. But if you get to this country and you're like, well, Melvis, there she goes again. Who cares about career progression? I can't be bothered. I'm just going to do my own thing, go to work, come back home. Look, you're going to see 10 years from now, you're going to be sat there regretting and saying, Melvis, I wish I listened to you 10 years ago. I would have already been X now. I would have already been Y. So time is going to pass either way. So you can as well get started today. And I share all information on this channel that can help you, that can guide you with those pathways to go through successfully. But obviously, if you need that tailored, individualized, and personalized guidance, then I offer that through my coaching program. But look, you don't need to join that. If you can follow the prompts for my videos and you're somebody who is really determined, you can still do that. I'm not saying you have to join my coaching program for you to progress in the UK. You don't have to. But if you want to make sure you've got the guidance, you're not struggling on your own, you know what I mean? You're not getting stuck, then you can join and I'll guide you with the process. Like I've said, I've got hundreds of colleagues currently going through this program, and it's just been mind-blowing the success that we have been able to have through this private coaching program, which, by the way, I've had this program for over 2 years. So it's not something new. It's full of resources. We have weekly live sessions, and there's all sorts of things that do happen. So like I've said, if you check the description box below or the about section of this YouTube channel, you're going to see a link to join that nursing career bootcamp. And then we can get started with that one-to-one session. What do we need? How do we proceed? And all of that. So again, I don't know what you think about all these changes, all these updates. But if you've got any questions, do leave them in the comment section below. If you haven't subscribed to this channel, you do want to hit that subscribe button so that you're the first to be notified every single day when I drop a new video on here at 10 a.m. UK time. Also, if you want to join my free newsletter, you don't need to pay anything. It's completely free. I send that info directly to your inbox. You can check the comment section below and you'll see a link to join. It won't take you 20 seconds. All you need to do is drop your name and email and you are part of that free newsletter. Because truth be told, as overseas recruitment is increasing, you know what I mean? There are more opportunities. There are more opportunities in this country that are currently being created. More hospitals are being built, more departments are being introduced, more senior positions are being introduced as well for those of us that are healthcare professionals, like I was saying earlier. So this is the best time for you to really focus on your career, for you to get into healthcare if you're not yet in healthcare, and for you to be able to make the most of the best opportunities that this country brings and that healthcare also brings. Because the truth is, many of us are in healthcare. It is not a coincidence. It's because of those opportunities. For example, guaranteed visa sponsorship. It's only healthcare that can guarantee you that visa sponsorship. If you look at other sectors, it is very challenging. It's like 1 in a million people. So you want to increase the odds for success. You want to increase your chances for success rather than being reliant on luck. Look, luck is not a thing. You need to focus on your own skills, build yourself, and make sure that you are putting yourself in the best position for success. So I'm looking forward, obviously, to seeing you in that private coaching program. If you watched the video till now, it's going to be absolutely perfect for you, and you want to watch this other video that I've linked up here because it is going to be absolutely perfect for you to watch next. So I'll see you in this video.